Did you know that about 20.9 million American adults, which is 9.5% of the adult population, are diagnosed with a mood disorder, which is the most top diagnosed mental disorder? My family has a history of depression and mental disorders, so I like to learn as much as I can about them. Mental disorders are a serious problem in the U.S., and everyone should know about their symptoms and treatment. First, I will talk about eating disorders, which can include anorexia, bulimia, and binge eating. Second will be personality disorders, which can include antisocial disorder, avoidant, and borderline disorders. And finally, I will talk about mood disorders, which include bipolar, major depressive, and dysthymic disorder. By the end of this speech, you will know the top 3 mental disorder categories, plus their symptoms and treatments. Okay. First is eating disorders, which, as I said before, can include anorexia, bulimia, and binge eating. Anorexia consists of the lack of eating and seeing oneself as fat instead of the malnourished skeleton they are. Symptoms can include failure to eat and also an obsession with food in respect to weight gain. Bulimia consists of eating large amounts of food and later regretting it and then vomiting it back up with the use of laxatives and overexercising. Symptoms can include seeing yourself as overweight when you're not and vomiting up your food after eating. Binge eating isn't as talked about as often as anorexia and bulimia, but it's still just as important. Symptoms include cycles of overeating, low self-esteem, and signs of manic depression. Overeating leads to feelings of shame which leads to more overeating and excessive weight gain. Treatment of eating disorders is fairly simple with the right therapy and strict diets. Over the last 25 years, research suggests that the best way to treat anorexia is family-based intervention. If you believe you are suffering from an eating disorder, you should seek a psychiatrist and a nutritionist. Far more serious than eating disorders, personality disorders are the second most diagnosed in the U.S. All personality disorders have similar symptoms, such as rigid personality traits that can affect daily functionality. Antisocial disorder is the most common. Symptoms can include disregard to authority and little regard for others' feelings. They can also include criminal behavior and no remorse for actions. Another common personality disorder is avoidant disorder. Symptoms of this can include feelings of hopelessness and worthlessness, and also feelings of being over-controlled. They can also include a fear of criticism and a hesitance to get involved with others. The last personality disorder I will discuss is borderline. Symptoms of this can include unstable and impulsive suicidal thoughts, threats, or attempts, as well as fear of abandonment, and those who suffer from borderline personality disorder also find it harder to maintain stable relationships. Treatment of these is fairly difficult due to biological and environmental factors. Also, those with personality disorders have a high potential for drug abuse. Mood disorders are very similar to personality disorders and are also difficult to treat, and they are also the top diagnosed mental disorder category in the U.S. These can include bipolar disorder, major depressive disorder, and dysthymic disorder. There are similar symptoms in all 3, such as severe emotions, and they are also more common in those who are single. Bipolar disorder consists of severe mood swings ranging from manic or high to depressive or low. Symptoms can include moments of extreme happiness and sadness, as well as thoughts or threats of suicide. Bipolar disorder is very treatable with the right combination of medications. Major depressive disorder is exactly what its name implies, major depression. Symptoms can include persistent sadness, feelings of hopelessness or worthlessness, fatigue, lack of focus, changes in appetite, and thoughts or attempts at suicide. Dysthymic disorder is just like major depressive disorder, except that it's less severe, but it is also more chronic, which means it lasts a lot longer. Major depressive is in short sprints of only a couple weeks, while dysthymic can last for up to years. Treatment of all these can be fairly easy with a good combination of medication and therapy, although it can be hard to find the right combination due to varying severity. As one can see, mental disorders are a serious matter and should be dealt with accordingly. Mental disorders are serious and hard to treat if no professional help is sought. Eating disorders can be treated by family-based therapy and diet therapy. Personality disorders, as well as mood disorders, are hard to treat due to different severities. With 9.5% of the adult population suffering from mood disorders in the U.S., it's extremely important to be informed about symptoms and treatment. If you believe you or a loved one is suffering from a mental disorder, please seek professional help immediately, as without treatment, symptoms only get worse.
Yeah.